Welcome back. In the months leading up to the November election, the youth of America made their voices heard in an unprecedented way, supporting the president, now president. Yet when it comes to health care, the young people, they seem to be absent from the debate. So where do they stand on universal coverage, and how do they feel about footing the bill? Join us today. We have got from Barnard University, Lauren Saltz, and Barry Weinberg is from New York University. Meanwhile, David Laska, I've messed this up. Lauren Saltz is from Barnard. David Laska is from NYU. Kate O'Gorman is from Barnard. And Barry Weinberg is from Columbia University. Thanks to all of you for joining us.
Thank you.
All right, Lauren, let's start with you. Have you been watching the debate on television?
I've definitely been watching the debate on television.
And what do you think?
I think that health reform, in principle, is a good idea for young people, but I think the current form of the bill is unacceptable.
Because there are a lot of people, Barry, in your age demographic who are eligible to buy health insurance right now, but they don't want to because they figure, you know, I don't want to spend the money. I don't have a lot of money. I'm healthy. I'm bulletproof, essentially.
Well, unfortunately, I think that's a mentality that a lot of us have, but you know, healthcare originated with catastrophic coverage to cover events that aren't necessarily predictable, and that's the coverage that we need. So if I get into a car accident or get hit walking across the street after this, I'm going to want healthcare, right, and I'm going to want health insurance to cover that. But
that's a very mature ideal, because a lot of kids your age simply are going, okay, it's going to cost me $25 a month or a week at more at work. If I do this, I'd rather have that money for myself. So they don't get it.
Right, and I think that's one of the benefits of maybe having a public option that could extend some of that to younger folks like me.
Okay, so even though they don't want it, it's going to, David, be jammed down their throat if we wind up with universal care.
Well, absolutely, and I think one of the things that is potentially disastrous about this bill is that it really does have the potential to destroy the quality of health care that does exist for some people in this country. The pay or play option, excuse me, in particular, is potentially troubling. What you have is that companies can either provide full insurance for all of their employees or face an 8.5% tax.
That's right.
If they choose not to play, they can pay. That is to say, they can pay that tax and take their coverage away from the employees that do have it. That could potentially lead to overburdening the system and a further rationing of healthcare than we already have.
Kate, what do you think?
And see, for me, I believe that healthcare, when we're talking about a public option or when we're talking about young people, we need to especially make sure that young people have access to health care. Young people are more likely to not be offered health care insurance under their employer at about a rate of half of what older Americans are.
I know, but there are so many young people who are offered it and simply say, you know what, I'm healthy, I'm not going to take it.
And you see, for me, I think that's a fallacy. I think all young Americans want health care. I think we want health care in order to be able to provide for accidents. I tore my ACL my junior year of high school, and I could only imagine the debt that my family would be if I wasn't fortunate enough to have health care. And so I think that, you know, going forward, we need to go with the understanding that most young Americans probably want health care. They don't want to be saddled with medical debt. And if there's a case where somebody doesn't want health care, then I think we need to figure something out. But I don't think that it's the norm that people don't want health care.
Okay. Although I know a lot of kids who are of college age, and none of them are even paying attention to this debate, because they figure, you know what, that's what you do when you're old and you're sick and stuff like that. Anyway, we're going to continue the conversation. Excellent comments so far. Our panel is going to talk about next a new proposal that would give the president essentially control of the internet. If he's deemed it an emergency, he could simply flip a switch and turn it off. What about that? Straight ahead. And some good news about those massive bailouts you helped pay for. The U.S. government actually making some money off of them now. We'll tell you why. Straight ahead.